Periods, 10 things every parent should know before their child starts. When your child gets their very first period, that's not the time to start learning or talking about periods. Ideally, you should kind of see it coming, should have talked with them about it, and be at least a little bit prepared. As an adolescent gynecologist and someone who's helped guide hundreds of parent-child pairs through this transition, I want to share with you the 10 things every parent should know before their child starts their period. Number 1, you don't have to be an expert. While you don't have to be an expert on periods, it is your responsibility as a parent to safely and appropriately guide your child through this transition. By utilizing trusted resources like this video, you are already well on your way to providing the support, understanding, and knowledge that your child will need during these first few years. Number 2, you should see it coming. Your child's first period shouldn't shock you. While you won't be able to necessarily predict the day or the week, there are many signs that let you know that your child has entered puberty and that periods are on the way. Most people don't know this, but the first sign of puberty is growth of the hands and feet. Other pubertal signs include the development of body odor, acne, underarm and pubic hair, and breast development, of course. Breast development is one of the key signs of puberty because periods typically start approximately 2 years after breast development begins. Breast development starts with a smaller, typically tender bud under the nipple area and then progresses to growth of the breast tissue around the nipple and areola. Periods typically start after this stage of breast development. Any of the above signs can be your signal to start preparing for what's to come. Number 3, you should check your baggage. Not everyone has had positive experiences around periods, puberty, or reproductive health. Sometimes I find moms immediately burdening their daughters with fears of the pain, suffering, or mistreatment that they personally experienced, unknowingly casting a negative light on this normal stage of development before their child or teen can even try out their first pad. I want parents to really deal with those things, the things that they didn't understand, the things that may have surprised them, the pains they may have experienced, and just the ways in which puberty may have altered friendships or even family relationships. For some fathers, this may be a moment to really evaluate how you viewed periods or puberty in your adolescent years and acknowledge any negative associations that you may still carry today. This is a deeply personal process and may take longer for some than others, but it's critical to start with this so your child gets a chance at having their own period or puberty experience instead of reliving or even paying for the damages of yours. Number 4, periods are normal. It's critical to understand that periods are normal, so there's no need to panic. They are something that we expect, and if we're honest, we'd be even more alarmed if our child just never got a period. I've seen patients for this very issue. And while the causes can vary, there is almost always deep anxiety and fear that they may not be capable of the normal process of carrying a child or bringing life into this world if they so choose. Celebrate that your child is undergoing normal development. Not every child has this privilege. Number 5, the purpose of periods is pregnancy. I'm not saying that your child's purpose is to become pregnant. I'm saying that periods and the physiologic process of menstruation is all about pregnancy. Even puberty is about the transition of the more childlike body to a more adult-like body for the purpose of reproducing. The actual period is the process by which our body prepares for pregnancy on a pretty much monthly basis. When pregnancy doesn't occur, the lining of the uterus that has grown since the last period sheds and prepares again for the possibility of pregnancy the next cycle. For this reason, it's tough to explain periods without discussing pregnancy. Many parents don't want to think about it, but once periods start, pregnancy is possible. While you may feel that they're too young to be pregnant, that doesn't change the fact that their body has now become capable of it. It's better to acknowledge this and make your child or teen aware. Number 6, the conversation is only as awkward as you make it. When we think about explaining periods to a child, it gets super overwhelming, mostly at the thought of talking about bleeding, pregnancy, and even sex. So no, you don't necessarily have to broach all of these topics all at once. But I want you to think back to when you guided your child through one of the strangest things there is. Their baby teeth falling out, blood, pain, and random dangling tooth and all. And what did you do then? You just reassured them that they would have adult teeth in the future and that you'd be there by their side. Your kid didn't panic or throw a tantrum because you calmly explained that what they were experiencing was normal and that everything would be okay. We don't have to separate this so much from periods. Periods can be a bit messy. They're involuntary. They're sometimes uncomfortable, but they are an expectation of normal health and development. Lean into this fact, and your child will follow your lead. Number 7, your child is not immediately an adult. Just because your child is in puberty or getting periods does not mean that they are automatically an adult overnight. Saying phrases like, "you're becoming a woman," is not necessarily wrong, but the idea that an 11-year-old or a 9-year-old, for example, is now a woman because their body elected to spontaneously start this process is a little bit unfair. Try not to think of periods and puberty as an ushering into adulthood, but really just a stage of childhood. Number 8, periods aren't dirty. It's an easy argument to just say periods aren't dirty because they're normal. But the rebuttal would be, that's not true. Pooping is normal and that's dirty. Urinating is normal and that's kind of dirty too. Well, first, periods are not part of our control. We can't hold our period in, and we don't get clear cues from our brain for when our periods are about to start. No, we don't need to have used products strewn about, but we also don't need to make a person feel dirty because they are on their period. I think that a lot of societal and cultural norms have been focused on making periods something very negative. Shifting that focus to something positive really can improve your child's self-esteem as well as their acceptance of their body's changes during this time. Number 9, periods can become abnormal, so always keep an open line of communication. There are normal ranges for the period, so you need to try to set some baseline parameters for your child. Let them know that they need to let you know when they're on their period. They need to let you know if they're bleeding enough to change a menstrual product more than once per hour. They also need to let you know if they're bleeding longer than 7 days. That's abnormal. And they need to let you know if they have pain or nausea or other period-related symptoms that make it hard for them to complete their daily activities. The truth is, a culture of silence around periods is harmful. I've actually had patients that bled for well over a month without seeking help because their parents told them not to talk about their period. When you set this expectation for your child, you set them up for dangerous possibilities. The reality is, periods can cause significant health issues. Abnormally heavy or prolonged periods can lead to severe anemia. Conditions like endometriosis can cause debilitating pain. The more severe form of PMS, known as PMDD, can cause emotional or mood disturbances that can affect your child's daily life. By ignoring these things or preventing your child from speaking about them openly, you can prevent them from getting the care they need. Number 10, periods aren't just for the girls or women to understand. It's really everyone's role to promote a safe and positive environment around health. It's not just mom's role, it's not just aunt's role, it's not just older sister's role or grandma's role. It can and should be dad's role too. As an adult who is committed to providing the best care for your child, guidance through normal stages of growth and development is the minimum that you should be doing. Even siblings need to be part of the conversation to truly change the culture around periods. Even if you didn't have a great period experience, you can change that for your child by being the parent or the guardian that you wanted to have while you transition through your puberty and period years. It's not too late. It's not too hard. You are more than capable, and you are the right person for the job. If you learned something new in today's video, please like, comment, subscribe, and share. I'm Dr. Shara Chambers. Thank you for watching.